All right, let's talk about one of the biggest buzzwords in medicine right now, platelet-rich plasma, or PRP. You've probably heard about it from athletes, maybe some celebrities. But what is it really? Does it actually work? Well, we're going to get into all of it.
I mean, think about that for a second. What if the key to looking younger, to even reversing hair loss, wasn't in some synthetic cream or complicated procedure, but was already flowing through your veins? That's the big promise of PRP, and it's a pretty incredible idea.
So to really get a handle on this, we've got to start with the basics. What exactly is this stuff that some people are calling liquid gold? It all starts with your own blood.
Okay, so at its simplest, platelet-rich plasma is just a tiny fraction of your blood that's been supercharged with platelets. The most important word here is autologous. It's a fancy medical term that just means it comes from you. It's from your own body for your own body. No foreign substances, no risk of rejection. That's a huge deal. And you might think the process to get it is super complex, but it's actually pretty simple. It starts with a standard blood draw. Then, that vial of blood goes into a machine called a centrifuge, which spins it around like crazy. We're talking really, really fast. And that spinning motion is what does all the work.
So as it spins, your blood naturally separates into layers. You get the heavy red blood cells sinking to the bottom, the lighter plasma floating on top, and right there in the middle, that's the good stuff. It's this thin, golden yellow layer called the buffy coat. And that little layer is the PRP. It's packed with anywhere from 2 to 8 times the normal concentration of platelets. It's a powerhouse.
But why do we even want all these platelets? Well, think of them as tiny little biological first responders. They're jam-packed with these things called growth factors. You can see a bunch of them here. They are literally a cellular construction crew. When they're injected into an area, they send out signals that tell your body, hey, we need to repair things here, build new tissue, make new blood vessels. For example, VEGF basically tells your body to lay down new pipes, new blood vessels, to bring in all the nutrients an area needs to heal and grow. Okay, so that's the science. But what does the cellular construction crew actually do in the real world? Let's look at one of the most common uses for PRP, getting hair to grow back.
So the big question is, does it work? Well, the data is pretty compelling. When researchers pooled the results from a bunch of studies, they found that PRP treatments resulted in an average increase of almost 46 new hairs in every single square centimeter. Now, for someone dealing with thinning hair, that is a difference you can absolutely see and feel.
But here's what might be even more impressive. It's not just about growing new hair. It's about stopping the hair loss you already have. One study showed that for 93%, almost all of the male patients, their hair loss just stopped. And that happened within 2 months of starting PRP. That's a game changer.
Now, it's important to know this isn't a one-shot miracle cure. The way it usually works is you'll go through an initial set of treatments to really get those follicles woken up, and then you'll need to go back for maintenance shots every few months to keep those results going. It's definitely a commitment.
All right, let's move from the scalp to the skin. Because beyond hair, PRP is making huge waves in aesthetics as a totally natural way to improve your skin and even treat stubborn scars.
The way it works for skin is just elegant. Those growth factors we talked about, they basically send a wake-up call to your skin's little collagen factories, the fibroblasts. They kick into high gear and start pumping out new collagen, and more collagen equals skin that's firmer, smoother, and just looks healthier. That's why people call it a natural filler. You're not injecting a foreign substance. You're just telling your own body to rebuild itself.
And this is where it gets really interesting. PRP becomes a true superstar when it's combined with other treatments, like for acne scars. For example, if you add PRP to a microneedling session, you can get results that are just as good as a powerful laser. But, and this is a huge but, look at the risk of post-inflammatory hyperpigmentation. You know those dark spots that can show up after a procedure? With PRP, the risk is less than 2%. With the laser, it's 10%. That is a massive difference.
So, PRP sounds incredible, right? It seems like a wonder treatment, but there's a problem. A really, really big problem that's holding the entire field back, and it all comes down to standardization. This quote from one of the research papers really nails it. Right now, there is no one-size-fits-all recipe for PRP. Every clinic can do it differently. They might use a different machine, spin the blood for a different amount of time, use a different technique. It's kind of the Wild West out there.
I mean, just look at this. There's a huge debate in the field about whether you should include white blood cells, leukocytes, in the mix. Some people say yes, they help modulate the immune system. Others say no, they just cause unnecessary inflammation and swelling after the injection. The science isn't settled, so different doctors are making different choices.
And this lack of a standard leads to results that are, well, they're all over the map. You have to hear this. One analysis found that just by changing the machine used to make the PRP, nothing else, the results for hair growth went from an incredible gain of 90 hairs per square centimeter all the way to a loss of 73 hairs. That's right, some people lost hair. It's the same basic idea, leading to completely opposite results. It's a huge problem.
So with all that variability and uncertainty, you're probably asking the most important question. Is this stuff even safe? Let's get to the bottom line.
And here's the good news. Despite all the inconsistencies in results, PRP is, at its core, incredibly safe. Remember that word autologous, because it's from your own blood. The chance of having an allergic reaction or catching a disease from the product itself is basically zero.
Now, you are getting injections, so you can expect the usual suspects. A little bit of pain where the needle went in, maybe some redness or swelling, a bit of bruising. That's all very normal. And the best part is it almost always goes away on its own in just a couple of days.
Okay, we do have to talk about the serious risks. They are extremely rare, but they can happen. The biggest one is infection, which can occur if a clinic isn't using perfectly sterile equipment. And there's been one reported case of blindness, which happened when a facial injection accidentally blocked an artery to the eye. It just highlights how critical it is to go to a doctor who is extremely well trained and knows exactly what they're doing.
And finally, there's the practical side of things, money. For cosmetic uses like hair and skin, PRP generally isn't covered by insurance. And with sessions costing anywhere from $500 to $700 a pop, a full round of treatment can add up fast.
So that leaves us with this big question. What is PRP? Is it a genuine medical revolution that's changing the game? Or is it just a really promising science that's still trying to figure itself out, still searching for that one standard that will let it be great every single time? For now, the answer seems to be, well, it's a little bit of both.